For the side effect of radiotherapy, it will be depending on a few factors. Factor 1 will be depends on the site where the radiation is being delivered. And the second one will be based on the total dose of the radiation that is being prescribed by the doctor. And third will be the number of sessions being given. So for example, if we were to give a radiation to the head and neck region, but because the prescription given is of different dose and different sessions, then the side effect might differ a lot as well. So for example, if I were to give a patient 5 sessions of radiotherapy to the head and neck region, generally the patient would not have much of a side effect, except for maybe some of the patients might have a bit of lethargy after the session, but generally most of them will not have much of a side effect. As opposed to if I were to deliver 35 sessions to the same region, then these patients tend to have more side effect, especially towards the end of the radiotherapy sessions during the 3rd week, 4th week, 5th week, 6th or 7 weeks, where they will suffer some side effect. For instance, like their skin might get burned, they might have a bit of oral ulcers, they might have difficulty in swallowing because of pain, they might feel like their mouth is a bit dry, and they might even have loss of their taste bud during the sessions. So like I mentioned earlier, depends on the site where you are delivering the radiation. So generally the side effect will only comes from the site where we are delivering the radiation. For example, if I'm irradiating or giving the radiation to the breast area, generally the patient will not have any head and neck side effects, or side effect of other parts of the body. So the side effect generally will be coming from the breast area. So some of the common side effects that may happen if we give radiation to certain site, for instance, like radiotherapy to the breast, then the patient might actually have a bit of tiredness, then the skin might get a bit red. In certain small number of patients, they might even suffer burning of the skin, right? Or as well as sometimes some of them might even have a bit of inflammation of the lungs because of the radiation. But most of the patients generally will not have a lot of side effect from giving radiation to the breast region. The other side effect by giving radiation to the other side, for instance like pelvis, some of the side effect common ones will be like diarrhea, urinary tract infection, where the patient will complain of when they try to urinate, they feel a bit of burning sensation or burning pain. Those are some of the common side effects that may happen if we give radiation to the pelvic region. Whereas for radiation to the head and neck region, like I said, it's very much depending on the session and the dose that we give. So if we were to give a high dose and a lot of sessions, up to 35 sessions to the head and neck region, the patient might have side effects like lethargy, oral ulcers, burning of the skin around the neck region. They would have difficulty in swallowing. They might even have their loss of taste bud as well, or even dryness of the mouth during the session. But all these, most of them will recover slowly after the treatment is completed over a duration. Normally during the initial first 2 weeks of treatment, the patient generally do not feel much of a side effect. So most of the side effect only comes in after the 3rd week. But also, of course, it's very much depending on individual. Some patients might have it earlier, but some patients might not even have any side effect even by the 3rd week. The side effect might not be the same for everyone because everyone will actually responded differently to the radiation that we actually delivered. So for instance, if you were to deliver the radiation to the same site, same dose as well as the same number of sessions to 2 separate patients, one patient might develop more side effect on the skin, for instance, whereas the other patient might not have that much of a skin side effect, but more of the other side effect, for instance like oral ulcers. They would actually might have different type of side effects, even though we are giving to the same site with the same session and dose, because it is depending on how the body reacts to the radiation itself. If a patient do have side effect from the radiotherapy, it is advisable for them to actually consult and talk to their primary doctors on the side effect. For an example, if the patient develops some rash or redness over the site where we give the radiation, please do not apply any ointment or medication on your own on the surface of the skin, because if you have something on the skin while you actually go for the radiation therapy, it actually can cause a side effect to get even worse. So please talk to your doctors if you have any of these side effects, so that the doctors can give you the right advice. And when you clean the area where we are giving the radiations, please do not, when you take shower, right, please when you dry it, please do not wipe it this way, just dab it dry to minimize the abrasion on the skin, because that will also actually cause the side effect to be worse as compared to if you take care of it well.